The Centers for Disease Control has loosened its mask guidance as more people become vaccinated, saying fully vaccinated people need only use them outside if they are in big crowds. More school districts in Wisconsin are dropping their mask requirements, and Dane County this past week increased its indoor capacity recommendations to 75%. We're talking about these steps back toward normalcy now with Ajay Sethi, Associate Professor of Population Health Sciences at UW-Madison. Ajay, good to see you. Thanks for your time today. Let's begin with this CDC guidance. In practical terms, how significant is this new guidance that was out this past week?
It's important. It's reflective of what the science is showing, that when you're vaccinated, for one, you can feel very confident that you're protected against getting severe COVID. And so for that reason alone, the mask can come off. Also, when people are vaccinated, they're less likely to catch the virus. It's not impossible. So breakthrough infections do occur, but people tend to be a little less infectious, but that science is still being learned. Overall, people who are vaccinated are not going to be contributing to ongoing spread like unvaccinated people would be.
I think there's a little bit of confusion still out there, especially among parents when you look at people under 16 who can't get the vaccine yet. From the guidance, do kids still need to wear masks outside?
Yeah, really everyone should be wearing masks if they're unvaccinated. The COVID is still at high levels in our communities. And if we relax our precautions, very easily we can experience a surge that neighboring Michigan has done and also other areas of the country.
I think broadly, when we talk about this and we look at the vaccinations, I'm sure you've heard there's some frustration. The thought was perhaps once I get vaccinated, once there is vaccines across the community, that we'll be able to drop the masks.
Yeah, I mean, if everybody is vaccinated, we'll see case rates go down. And when case rates go down, the need for masks will decrease. We're not there yet. So right now, unvaccinated people need to stay cautious.
We've seen school districts begin to debate this, school boards within the past week across the state, whether to continue mandating masks for this spring, for the summer, for the fall. Do you think the CDC is going to change its guidance on masks in schools? And what do you anticipate this is going to look like, especially when we look to the fall, to the next school year?
I mean, everyone is capable of picking up this virus and passing it on when you're not vaccinated. And children, I understand there's a lot of mask fatigue, really for everybody, and children maybe especially. Unfortunately, when the masks come off, the cases begin to spread. And if that school is in a surrounding community where a lot of adults are not vaccinated, particularly the vulnerable who have underlying conditions, we will see a surge fueled by transmission that occurs in those schools where people aren't wearing masks.
At what point do you think we'll be able to get rid of masks altogether in terms of any requirement or guidance to wear them indoors?
When the case rates come down to a point where we can go through a week, 2 weeks, where no one is being diagnosed with COVID, we can feel much safer as we sort of go back to normal. At that point, the use of masks is not going to be as important. Right now, because we have high activity levels for COVID transmission, masks are imperative.
A lot of developments this past week, a lot of developments to come. Ajay Sethi, Professor of Population Health Sciences. We appreciate your expertise like always. Good to see you. Thank you.
Thank you so much, Matt.
Next, the other step toward normalcy we saw this week.